Hello my dear future nursing officers, welcome back to my channel. Past 2 days we did not post classes due to some technical issues. Sorry for convenience. I don't want to waste your time. Let's start first MCQ. Burns are classified on the basis of option A, type of burn, option B, depth and area, option C, cause for burn, option D, bleeding from burnt area. Correct answer. Option B, depth and area is correct answer. Burns are usually classified on the basis of depth. Grade 1, grade 2, grade 3, grade 4 and extension of burn area. We will move to next MCQ. Which type of burn is painless? Options are first degree, option B, second degree, option C, third degree, option D, none of the above. Correct answer. Option C, third degree is painless. We will see rationale of this question. The third degree and fourth degree burn are painless because it destroyed nerve endings of pain in the skin. Burn that extends through the full thickness of the skin along with subcutaneous tissues called third degree burns. Move to next MCQ. Blisters are mainly seen in option A, first degree burn, option B, third degree burn, option C, second degree burn, option D, fourth degree burn. In which degree blisters are mainly we are seen? Answer is option C, second degree burn or blisters are present. And blisters means collection of fluid below or within the epidermis, because second degree burn involve epidermis and part of dermis. So, fluid collection occur between dermis and epidermis. Move to next MCQ. In the case of burns, the involvement of the epidermis only comes under option A, fourth degree, option B, first degree, option C, third degree, option D, second degree. Answer is option B, first degree is correct answer. Next, first degree burn is a superficial burn in which burn is limited to outer layer of the epidermis. It is marked by redness, tenderness and mild pain. Common example is the sunburn is correct. Next MCQ. Which part of the body are affected in case child had second degree burns? Option A, all epidermis and dermis. Option B, all epidermis, dermis including muscles and bones. Option C, epidermis 7/8 and dermis 1/2 appendages may be affected. Option D, epidermis 1/2 and dermis 7/8 appendages are affected. We will see correct answer. Option D, epidermis 1/2 and dermis 7/8. And in second degree burn, affected part of skin are all epidermis and 1/2 to 7/8 part of dermis. Next MCQ. The type of vitamin deficiency which can occur as a result of full thickness burn injury. Option A, vitamin A, option B, vitamin C, option C, vitamin B, option D, vitamin D. Answer is option D, vitamin D is deficiency in the case of burn. Next MCQ. What is the percentage of a large burn area to total body surface area. Option A, more than 10%. Option B, more than 35%. Option C, more than 25%. Option D, more than 50%. Answer is option C, more than 25%. Third degree burns over 10% of total body surface area and second degree burns over 25% total body surface area, and all fourth degree burns called major burn. Move to next MCQ. Accurate estimation of large burn areas is done by option A, rule of 9. Option B, patient hand approximated to 1% total burn surface area. Option C, land and Browder chart. Option D, calculation of body mass index. Answer is option C, land Browder chart is correct answer. So, rule of 9 and land border chart both are used for burn estimation, but land border chart is more accurate than rule of 9. And land border chart change surface area according to age and most commonly used into children to estimate burn size. Rule of 9 is used into adult patients. Move to next MCQ. 4-year-old female child suffered severe burns in a house fire. How will you examine the extent of her burns? Option A, by using the Parkland formula. Option B, by using the land and Browder chart. Option C, by using the Hartman formula. Option D, by using the rule of tens. Answer is option B, by using the land and Browder chart. Parkland formula we will use in fluid administration in burn patients, and rule of 10 is we will use in cleft lip patients. Move to next MCQ. Land Browder chart used for option A, head injury. Option B, acute abdomen. Option C, burns. Option D, bone injury. Answer is option C, burns condition we will use land Browder chart for children's. Next MCQ. Rule of 9 used in the burn patient for estimation of option A, burns percentage of total body surface area. Option B, burn injury. Option C, burn depth. Option D, dehydration. Correct answer option A, burn percentage of total body surface area. And rule of 9 used for estimation of percentage of total body surface area of skin that has been burned. For the adult, the head represents 9% and each upper extremity is 9%, the back of the trunk 18% and the front of the trunk 18%. So, 9% chest and 9% abdomen, and each lower extremities, lower limbs 18%. Each lower limb is 18%. Thigh part is 9% and below knee is 9% and perineum is 1%. Total body surface area is 100% in adults. Move to next MCQ. The burn area in children above the age of 10 years is estimated by one of the following. Option A, rule of 5. Option B, degree of burns. Option C, rule of 9. Option D, rule of 4. Correct answer Option C. Rule of 9 is used in burn patient. Next MCQ. Using rule of 9, percentage of the right lower limb burn is option A 4.5%, option B 9%, option C 18%, option D 22.5%. We will see correct answer. Option C 18% is correct. Next MCQ. A client admitted into emergency ward with circumferential burn into upper half of both legs and lower half of anterior torso. What would be percentage of burn calculated by nurse according to rule of 9? Option A 27%, option B 36%, option C 18%, option D 45%. Answer is option A 27%. Each leg percentage is 18%. So in this question they are asking half of both legs. Half leg is 9%. So both half legs is 18% and anterior trunk lower the part is 9%, only front side. So that's why 9%. So 18 plus 9 equal to 27%. Move to next question. What percentage does burns of genitalia constitutes by the rule of 9? Option A 9%, option B 18%, option C 1%, option D 21%. Answer is option C 1% is perineal burns. Move to next MCQ. 35-year-old female was brought to the emergency department with burn injury over the abdomen and perineum and both thighs. According to rule of 9, what is the percentage of burn injury for this patient? Option A 18%, option B 19%, option C 28%, option D 38%. Answer is option C 28% is correct answer. In this question they are asking abdomen, perineum and both thighs. So abdomen means lower half of the trunk 9% and perineum is 1% and both thighs not complete leg. So both thighs means 9% is one thigh and one more 9% is one more thigh. So total is 28% is correct answer. Move to next MCQ. 3-year-old child is admitted with partial and full thickness burns over 30% of the body. Which significant adverse outcome during first 48 hours should be prevented? Option A shock, option B contractures, option C pneumonia, option D hypertension. Answer is option A shock is correct answer. Next MCQ. When evaluating fluid loss in a burnt client, the nurse understands that the relationship between surface area and fluid loss is option A equal, option B unrelated, option C inversely related, option D directly proportional. Answer is option D directly proportional. Next MCQ. Priority care given to the patient with an extensive burn is option A body image, option B fluid status, option C level of pain, option D risk of infection. Answer is option B. Fluid status is first priority in burn patient. We will see rationale. Priority of care given to the patient with an extensive burn is changed according phase of management of burn. During resuscitative phase, so means first 48 hours to 72 hours, priority is maintaining fluid status, is fluid resuscitation, and during acute phase priority is asepsis to avoid risk of infection. Next, which one of the following is the emergency management of burn injury in the first 24 hours? Option A, dressing. Option B, plastic surgery. Option C, fluid resuscitation. Option D, antibiotic therapy. We will see answer. Option C, fluid resuscitation is correct answer. Next, the fluid replacement for burn patient can be evaluated after 48 hours by option A, weight. Option B, urine output. Option C, urine specific gravity. Option D, peripheral perfusion. Answer is option B, urine output is evaluation after 48 hours in burn patient. We will see rationale about this. Formulas of fluid replacement are guidelines. Actually, fluid is administered according assessment of adequacy of fluid replacement by following parameters. Urine output 30 to 50 ml per hour. It is most reliable indicator and commonly used parameter of fluid replacement. Systolic blood pressure more than 90 mm of Hg and pulse rate less than 120 beats per minute. Stable vital signs, probable peripheral pulses are complete sensorium. Next, the nurse is caring for 10-year-old and admission to the burn unit. One assessment parameter that will indicate that the child has a adequate fluid replacement. Option A, urine output of 30 ml per hour. Option B, no complaints of thirst. Option C, increased hematocrit. Option D, good skin turgor around burn. Answer is option A, urine output of 30 ml per hour indicates that adequate fluid replacement for burn patient. Next MCQ. During the first 24 hours of treating a patient for burns, you can assist in assessing fluid replacement needs by monitoring hourly. Option A, urine specific gravity. Option B, IV fluid rate. Option C, vital signs. Option D, IV fluid intake. Answer is option A, urine specific gravity is correct answer. Next MCQ. To promote post-burn hydration and kidney function, the nurse should option A, keep accurate intake and output, wait daily and maintain IV fluids. Option B, reverse isolation and measure urine specific gravity. Option C, reposition frequently and administer analgesic. Option D, note depth of respirations and measures. Answer is option A, keep accurate intake and output, wait daily and maintain IV fluids. Next MCQ. Best and easy way to monitor resuscitation in a burn patient is option A, monitoring pulse rate. Option B, monitoring blood pressure. Option C, monitoring urine output. Option D, monitoring hematocrit. Correct answer. Option C, monitoring urine output is best way. Next MCQ. Nurse is monitoring a burn child during the treatment of burn shock. The nurse understands that which of the following assessment provides the most accurate guide to determining the adequacy of fluid resuscitation. Option A, skin turgor. Option B, neurological assessment. Option C, level of edema at burn site. Option D, adequacy of peripheral pulses. Answer is option B, neurological assessment is correct. Move to next MCQ. 2-year-old child is admitted to burn unit with partial and full thickness burns over 35% of the body. After admission assessment and review of the physician order, the priority nursing interventions focuses on option A, sedation with morphine sulfate. Option B, inserting a Foley's catheter. Option C, inserting a nasogastric tube. Option D, restricting IV fluids. Answer option B, inserting a Foley's catheter. Next MCQ. Most commonly used electrolytes solution in burn cases is option A, dextrose 5%, option B, dextrose 25%, option C, sodium chloride, option D, potassium chloride. Answer is option C, sodium chloride. Next MCQ. Patient had chemical burn. The best initial action is option A, roll the patient in the blanket. Option B, flush the area with copious amount of water or normal saline. Option C, if chemical is an acid, neutralize with a base. Option D, move the patient away from the chemical. Answer is option B, flush the area with copious amount of water or normal saline. Now we will see rationale of this question. Tissue destruction caused by corrosive or irritating chemicals such as strong acids or bases, phenols, pesticides, disinfectants, fertilizers or chemical warfare agents called chemical burns. The best initial action for chemical burn is irrigation or flushing of burn site with large quantities of water to remove chemicals. Next MCQ. Chemical burn of the eyes are treated with option A, local anesthetics and antibacterial drops. Option B, hot compresses applied at 15 minutes interval. Option C, flushing of lids, conjunctiva and cornea with tap or sterile water. Option D, cleansing the conjunctiva with small cotton tip applicator. Correct answer option C, flushing of lids, conjunctiva and cornea with tap or sterile water. Next MCQ. The appropriate initial treatment of a chemical burn is option A, lavage with water. Option B, neutralize the chemical. Option C, apply the prescribed topical agent. Option D, wrap the patient in sterile sheets. Answer is option A, lavage with water. Next MCQ. Which complication may occur in severe burn cases? Option A, hypoglycemia. Option B, muscle atrophy. Option C, gastric ulcer. Option D, paralysis. Correct answer. Option C, gastric ulcer is correct. Next MCQ. Best advice given by a nurse to a patient with skin grafting on a burn wound. Option A, moderate exercise. Option B, keep affected part below heart level. Option C, keep pressure on site. Option D, immobilize affected part. Correct answer. Option D, immobilize affected part. Next MCQ. Which sign nurse would anticipate in a patient with inhalation burn injury if blood report shows carbon monoxide level 12%? Option A, coma. Option B, tachycardia. Option C, flushing of face. Option D, giddiness. Answer is option C, flushing of face. Next MCQ. Which of the following his nurse would anticipate to prescribed by physician to a patient with inhalation burn injury? Option A, 90% oxygen by mask. Option B, 10 liters per minute oxygen by nasal cannula. Option C, 100% oxygen by tent. Option D, 100% oxygen by tint fitting non-rebreather face mask. Answer is option D, 100% oxygen by tight fitting non-rebreather face mask. Rationale about this question. If an inhalation burn injury is suspected, administer 100% oxygen by tight fitting non-rebreather face mask until carboxyhemoglobin level falls below 15%. Move to next MCQ. Most common topical treatment used for burn wound which is effective against both Pseudomonas and MARS is option A, soframycin. Option B, silver sulfadiazine. Option C, 0.5% silver nitrate. Option D, mefenide acetate. Answer is option B, silver sulfadiazine. Rationale is silver sulfadiazine have the broad spectrum of activity against the gram positive and gram negative and yeast. It also has more penetrating capacity to Eschar tissue. Next MCQ. Silver nitrate dressing of burns may cause option A, abnormality in blood gases. Option B, abnormal blood count. Option C, depletion of sodium and potassium. Option D, increased blood urea nitrogen. Answer is option C, depletion of sodium and potassium is correct answer. Next MCQ. The most effective route of relieving pain during emergency phase of burn injury is option A, intravenously. Option B, intramuscular. Option C, subcutaneous. Option D, oral route. Answer is Option A. Intravenous is correct answer. Next MCQ. What kind of diet is given to a burn patient? Option A. High sodium diet. Option B. Low potassium diet. Option C. High protein diet. Option D. All of this above. Correct answer. Option D. All of this above is correct answer. So, in burn patients, we will give high sodium diet and low potassium diet and high protein diet. Next MCQ. Linear borrowing of a mite at finger ribs, wrist, elbow, ankle and penis is seen in case of Option A. Impetigo. Option B. Scabies. Option C. Psoriasis. Option D. Herpes zoster. Correct answer. Option B. Scabies is correct answer. Impetigo means honey-like crust around the mouth and herpes zoster is a virus. Next MCQ. All of the following are part of treatment of scabies except Option A. Topical permethrin. Option B. Oral ivermectin. Option C. Oral antihistaminics. Option D. Long-term oral steroids. Correct answer. Option D. Long-term oral steroids. Next MCQ. Benzoyl benzoate 25% is used in children for Option A. Rabies. Option B. Scabies. Option C. Leprosy. Option D. Ashes. Correct answer. Option B. Scabies is correct answer. Benzoyl benzoate is an aromatic, colorless, oily liquid used as a topical scabicide. Next MCQ. Which anti-scabies lotion is contraindicated into children younger than 2 years of age? Option A. Permethrin. Option B. BHC. Option C. Linden. Option D. Calamine. Correct answer. Option C. Linden is correct answer. Rationale about Linden. Linden should not be prescribed to children younger than 2 years of age because it is more permeable to skin, so may cause neurotoxicity and seizures due to systemic absorption. Next MCQ. Linden is a Option A. DDT. Option B. BHC. Option C. Malathion. Option D. Fention. Answer is Option B. BHC is correct answer. Next MCQ. In which among the following site can we obtain scabies mites? Option A. Hair follicles. Option B. Stratum corneum. Option C. Subepidermal. Option D. Throughout skin layers. Answer is Option B. Stratum corneum is correct answer. Okay, my dear future nursing officers, today's session burns is completed. Tomorrow we will be with most important MCQs for MHSRB exam. If you have any doubts, please let me know in comment box, and if you like this session, please do subscribe, like and share with others and click the bell icon. Thank you.